Hi everyone, I'm Connor. I work at Salford Royal as a trainee echocardiographer on the ETP or echo training program. I'm in the second cohort of that now. They just recruited for the third. I've held this position currently for about 16 months. I guess it's an 18-month program, so I'm coming to the end of it. And yeah, I got that job firstly at Macclesfield Hospital. They recruited me first. That was in September 2021. I spent 10 months there and then decided to apply for a role at Salford, and then I got transferred to Salford basically. So it's sort of got it through an external role straight after my master's from Liverpool. My current responsibilities are the same as pretty much any echocardiographer within the hospital. Now that's the case. So day to day is just consistent of having my own list, scanning up to 10 patients a day. At Macclesfield, I was also trained in ECGs and how to fit tapes. So they're transferable skills that I can bring to Salford. Considering I started life before the ETP as a waiter, so I've learned a considerable amount along the way on the ETP. So we did ECGs at uni, but basically how to echo, how to interact with patients, because I was used to dealing with people, but it's a different type of people, I think, in a hospital. I've had to learn how to adapt myself to that and how to respond to certain types of people. I've learned how my clinical skills have just developed from being next to nothing to being able to do a full echo, some ECGs, can fit tapes, like I said, at Macclesfield. I've been on courses at Liverpool Heart and Chest, watched TAVIs, I've seen an ASD closure, I've done a physiologist-led valve clinic observation. They're all really, really good experiences. The thing that's good and bad about my course, it's good in the sense that it gets you through, and it's you solely echo. You don't do anything else pretty much in the 18-month period, but that also can have its downfalls, is in the sense that it's very crammed, I think, and it's a lot of work to do in 18 months, especially alongside a full-time job. But it is a great way to get into echo if that's what you want to do. In the future, considering I've done the valve clinic observation at Liverpool, from then on I wanted to be a valve, or lead one of my own clinics eventually, a bit further down my career, and maybe become an advanced practitioner in years to come. But I love my job, hands down. I've never been able to say that before, so it's nice to finally be able to say that. And I would give some advice to my younger self and say, you're going to be disappointed early on with the dream of the career that you want, and you're not going to get it. But keep persisting, because you're going to find something a few years later down the line that you actually love and that you actually have a really big passion for. So keep going. And I would 100% recommend this career path to anyone.